Good morning, everyone. Happy Friday. It's so good to see you.
Good morning.
Good morning. Good morning. Happy Friday. Welcome to the last Friday of October. And we're making our way along in our childhood obesity and comorbidities series. We're actually on our fourth session today. So we're looking forward to a great didactic by Dr. Rail and two great cases. Dr. Rail, you have remote access, so whenever you're ready to go.
Okay. Thanks, Nikaya. Thanks, everyone. Good morning. We have a lot of content this morning. There are some significant barriers for screening for lipids in children. Those are both physician and health system barriers, so health professional and system barriers, lack of knowledge, a lack of belief in the value of screening. That's still pretty common. Lack of identification. Who should I screen? How do I identify them efficiently? Lack of knowledge of follow-up and treatment guidelines. So this is a common theme in the whole cardiovascular field. It applies to adults and to children. The more I know about how to treat a condition, the more likely I am to screen for it.
He had no significant past medical history. He did have a family history of diabetes. And when I saw him, I was concerned about his obesity. The most concerning part from the whole interaction was his diet. He was drinking sugar drinks every day, fatty foods. So basically, that was the main concern.
Any other questions?
I have a comment. I read an article a few years ago about ferritin and zinc, and a lot of kids, especially that have high carbohydrate, low iron diets, they tend to be iron deficiency. And the first step, the first manifestation that you see is the high ferritin. You have to make sure that you do a set rate, just because if they have an infection, ferritin is an acute reactant. So it could be high and not related to it, but sometimes we do it as a screening for iron deficiency in the babies when we start transitioning to food. And there's a lot of crackers and juices and things like that that doesn't have iron. So if you keep them and you don't supplement like with a normal vitamin, like probably in a few months, they will develop the iron deficiency.